Hello and welcome to the Wellness Oracle. I'm Dr. Praveen Ravishankaran, consultant surgical oncologist. In my clinical practice, one of the most common things I see is this. Patients come in, they are told that they have breast cancer, and the very next question is usually about surgery or chemotherapy or whether the cancer has spread. But there is one crucial aspect that is often gets overlooked at the beginning. Something that actually determines how we treat the disease, how aggressive it is, and what the long-term outcomes will be. And that is the biology of the tumor. Before we even decide on the treatment, before we even plan surgery or chemotherapy, we need to answer a very fundamental question. What kind of breast cancer is this? Because not all breast cancers are the same. Two patients may have the same stage, the same size tumor, and even the same lymph node involvement. But their treatments can be completely different. Why? Because the cancer behaves differently based on the internal biology. And today, I'm going to simplify the entire concept for you in a way that you will not forget. Let me start with an analogy. Imagine a cancer cell as a highly active factory. For this factory to keep running, it needs signals. Signals that tell it to grow, divide, multiply, and survive. These signals come through very specific pathways, almost like switches or control panels in a factory. Now in breast cancer, the most important of these switches are estrogen receptors, that is ER, progesterone receptors, that is PR, HER2/neu, and Ki67. Each one of these signals tell us something critical about how the cancer is functioning. Let's start with estrogen receptors or ER. If a tumor is ER positive, it means the cancer cells have receptors that bind to estrogen. Estrogen, which is a natural hormone that is present in the body, acts like a fuel for these cancer cells. It attaches to these receptors and stimulates the cell to grow and divide. Now at first, this may sound like a disadvantage, but in oncology, this actually gives us a very powerful therapeutic target. Because if a cancer depends on estrogen to grow, we can block that pathway. We can either block the receptor itself or reduce the amount of estrogen in the body. This is what we call hormonal therapy. Drugs like tamoxifen or aromatase inhibitors are specifically designed to interfere with this pathway, and the impact is profound. These treatments can significantly reduce the risk of recurrence and improve survival. Now coming to progesterone receptors or PR, PR is closely linked to ER. In fact, when the tumor is PR positive, it usually means that the estrogen pathway is functioning well. Clinically, tumors that are both ER and PR positive tend to behave in a more organized and less aggressive manner. They are slower growing, more predictable, and respond very well to hormonal therapy. So when we see an ER and PR positivity, it often gives us a sense of reassurance that we have an effective long-term treatment option available with us. Now let us move to something completely different, that is HER2/neu. HER2 is not related to hormones. It is a growth factor receptor located on the surface of the cell. In some breast cancers, this receptor is overexpressed, meaning that there are too many copies of it. Now imagine that ER may be like a fuel. HER2/neu is like a stuck accelerator pedal. It is continuously sending signals to the cell saying it to grow, divide, grow, divide. As a result, HER2/neu positive cancers tends to be faster growing, more aggressive, and more likely to spread if not untreated. But here is where modern medicine has completely changed the story. We now have targeted therapies that specifically block the HER2. Drugs like trastuzumab attach to the HER2/neu receptors and shut down the growth signal. So today, HER2 positive breast cancers, once considered a high-risk disease, is actually highly treatable with excellent outcomes provided the right treatment is given. Now let's talk about Ki67. Ki67 is a slightly different from others. It is not a receptor, it is a marker of proliferation. In simple terms, it tells us how fast the cancer cells are dividing. Think of it as a speedometer. A low Ki67 means that the tumor is growing slowly. A high Ki67 means that the tumor is growing rapidly, and is more aggressive. Now, why does this really matter? Because it helps us decide how aggressive our treatment should be. For example, if you have a tumor that is ER positive, which is usually suggests a favorable biology, but if the Ki67 is very high, it tells us that the tumor is behaving aggressively despite being hormone receptor positive. In such cases, we may still recommend chemotherapy along with hormonal therapy. So Ki67 adds an extra layer of understanding. It tells us the tempo of the disease. Now, when we combine all these markers, ER, PR, HER2/neu and Ki67, we can classify the breast cancer into distinct biological subtypes. This is where everything comes together clinically. The first group is hormone receptor positive, HER2/neu negative cancers. These are the most common types of breast cancer. They tend to be slower growing, especially if Ki67 is low. The backbone of treatment here is hormonal therapy, often given for several years. Chemotherapy may be added depending on the stage and the Ki67. The second group is HER2/neu positive breast cancers. These cancers are driven by the HER2/neu pathway. They tend to be aggressive, but the availability of targeted therapy has transformed the outcome. Treatment usually includes HER2/neu targeted therapy, chemotherapy, and the results today are extremely encouraging. The third group is triple negative breast cancer. This means that the tumor is ER negative, PR negative, and HER2/neu negative. These cancers do not respond to hormonal therapy or HER2/neu targeted therapy. So the mainstay of treatment is chemotherapy and increasingly immunotherapy. They tend to grow faster, but they can also respond very well to chemotherapy, especially when treated early. So, what you begin to understand is that breast cancer is not a single disease. It is a collection of different diseases, each with its own behavior, its own growth pattern, and its own response to treatment. And that is why when you do a biopsy, you don't just stop at diagnosing cancer. You go deeper and study these markers carefully, because these markers decide whether a patient needs chemotherapy, whether hormone therapy will work, whether targeted therapy is required, how aggressive the disease is likely to be. If I have to simplify all of this for you into one clear takeaway, ER and PR tells us if the cancer is hormone driven. HER2/neu tells us if growth signals are overactive. Ki67 tells us how fast the cancer is growing. And together, they tell us how to treat the patient in the most effective way possible. This is what we call as personalized cancer treatment. Not every patient needs the same therapy. Not every cancer patient behaves the same way, and understanding this biology allows us to choose the right treatment for the right patient at the right time. In the next video, we will build on this foundation and move into treatment landscape, how we actually use this information in real life, stage for stage, to decide surgery, chemotherapy, radiation, targeted therapy, and immunotherapy. At the Wellness Oracle, my goal is to bring forward clarity to you, to break down complex medical sciences into something practical, understandable, and meaningful. If this video has helped you understand breast cancer biology better, share it with someone who needs this clarity. And don't forget to subscribe to the Wellness Oracle, because informed patients make better choices. I'm Dr. Praveen Ravishankaran, and remember, the biology of the tumor defines the strategy of treatment. Thank you and have a nice day.